Welcome to Made in America. I'm your host, Neal Asbury, together with my good friend and co-host, Dr. Rich Roffman. Well, this week, we've seen another chapter in Obamacare. We're very pleased to be welcoming on to the show for the very first time Congresswoman Neal Hayworth of New York, represents the people of the Hudson Valley area. She's not only a congresswoman, but she's a doctor, and she is a very passionate doctor and a passionate congresswoman, and we love passionate people here at Made in America. Welcome to Made in America, Congresswoman Hayworth.
Thank you, Neal and Rich. I am delighted to be with you.
So tell us, I've seen your interviews and I've read on your press release that you're calling Obamacare economic malpractice. Great soundbite, but explain that to us.
Well, as a doctor, I have 20 years of experience with patients. I know how it is for people to have access to good, affordable health care, to have affordable, portable health insurance. As a doctor, the only female physician who's a member of Congress, and as a Republican, a proud Republican, I support the goals of this law. But it is absolutely the wrong law. This is a case in which the cure is worse than the disease. And the reason I say it's economic malpractice is because what the Affordable Care Act does, unfortunately, very regrettably, but predictably, is imposes $2 trillion at least of Washington-generated cost in taxes, in penalties, in enterprise choking regulations. It imposes that deadweight cost on the American people at a time when we are headed towards $16 trillion in debt, and we are not growing our economy. It is absolutely the wrong thing to do, and of course that law is part of the reason we're not growing our economy. We can do far better, and if we can repeal and replace, we will do better.
Well, Congresswoman Hayworth, great words, but does this vote really mean anything, and what will it do? And I would like to take note that 244 voted for repeal, or to just get rid of the whole thing, and 185 voted to keep it. But there were 5 Democrats who voted to trash Obamacare, which incidentally is 5 times more Democrats that voted against Obamacare than Republicans who voted for it. That's not a big bipartisan margin, but at least Democrats did join you this time.
Yes, and because let's face it, poll after poll has told us that a plurality to a majority of Americans still reject this law. It's not becoming more popular with time. And that's the reason I've said this was not a symbolic vote. Not at all. We are expressing the will of the American people. And it is absolutely a shame and a terrible loss that the Senate and the President adamantly refuse to recognize that will. I feel as though it is already starting, and I can tell you it's remarkable. On the ground in the district, the beautiful Hudson Valley that I am so privileged to serve, and I have been working every day since the last election, and of course I worked every day up to the last election for months and months and months. People have gone out of their way to tell me, and I hear the occasional positive. So I'm not, trying to be overly one-sided about this. I'm not trying to be one-sided, but I will tell you that overwhelmingly people go out of their way to tell me, you are going to get rid of that law, right? They know. In the state of New York, we have very expensive insurance to begin with. More than 50 insurance mandates. These policies are punitive for individuals and small businesses, and their premiums, by and large, have gone way up. So they are suffering the consequences already. It is definitely a break on hiring. It is an economic problem already for the state of New York, and it's heartbreaking because we could do so much better. And I think it will revive that movement, because we know now with the Supreme Court's decision, we know the only way we will be free of this burden, to do things right and put the patient back at the center of care, not Washington, is to repeal and replace this law. We need House, Senate, and White House aligned.
So you get the House, but you also need the Senate.
Yes.
And but if you don't have 60 votes, then it's got to go through reconciliation, or it's got to go, I guess, coming up as something that's got to do with expenditures. But do the Republican governors, or do all governors have a big word in this? Because if governors don't buy into the Medicare part of this, does that mean that Obamacare doesn't get implemented? So, two points. Can they do it without 60 senators? And can the Republican or all governors just rebel against it and it dies?
Well, and there are reconciliation schemes that have been proposed. Here's how you can do it, because certainly you can defang some very onerous parts of the law through a reconciliation mechanism. The president, of course, can issue, and Governor Romney has vowed that he will issue an executive order providing waivers for all 50 states. But of course, that does depend on the governors accepting those waivers and actually taking advantage of them.
Congresswoman Hayworth, thank you for being on Made in America. Very, very great to have you with us. And I love the economic malpractice thing. Thanks for being on the show.